8:32, welcome back. Harmony and Health is a unique study with the goal of preventing cancer in at-risk Black adults. The program is currently recruiting people who would like to be involved. Joining us this morning to explain more about the study is Dr. Mama, Assistant Professor of Health Disparities Research at UTMB Anderson Cancer Center, and George Anderson, a study participant. Good morning to you both. Thank you so much for coming in and having this conversation. This really is an interesting conversation. It's unique, and it's one that we're hoping more people want to get involved with.
Yes.
I hope so.
Talk to us about what's required for participants interested in getting involved in the study.
Sure. Well, we're looking for adults who are at least 18 years of age, who are at greater risk for cancer based on their physical activity, sedentary behavior, have overweight, obesity, and are willing to participate. They're interested, ready to do something about it, and, want to get involved.
Yes. How long is the study?
The study itself is an 8-week program,
Okay.
But then participation in the study lasts 6 months.
Oh, wow. What has it been like to participate?
So I'm the Chief Operating Officer at the Fountain of Praise, and our church is one of the host sites for this research. So it has been phenomenal. Our senior pastor, Dr. Remus Wright, we really promote health, and we've been longtime strategic partners with MD Anderson. So it's been a wonderful experience working with Dr. Mama.
Yeah, and we know cancer it's so impactful, whether it's your own personal story with the disease or if you know somebody who has been impacted by it. So this is something that I think resonates with almost anyone and everyone. Talk to us about the correlation, the impact, the influence physical activity has on the disease.
Yeah. So I think that a lot of cancer risk can be attributed to modifiable lifestyle factors like physical activity, reducing your sedentary behavior, eating a healthy diet. And a lot of folks don't necessarily meet recommendations for those things, right? So physical activity itself can be somewhere between 30 to 50% of certain cancers. It's associated with 13 different types of cancer.
Wow.
And can reduce your risk for these cancers. And I think that, this is a well-kept secret and shouldn't be, right? And so our goal is to help people move more, sit less to reduce their risk.
Does the study take into consideration environment?
As in like the home environment or the neighborhood environment?
Yes,
all
the above.
Yeah, so we do give people tools. There is a health education component to this, to how can we better utilize our own environments to promote active lifestyles.
Yeah.
And
George,
speaking of environment, we are, as a society, much more rushed. We do more transit, so our transport time is long. And so we find ourselves challenged with being able to do or commit to doing exercise and those old routines that used to give us activity.
Yeah. A lot of sitting, and it's all cyclical, right? Whether we are talking about environment or physical fitness, if you break everything down or break everything up, it's easy to connect the dots at how they all go hand in hand and influence the other. For people interested in participating, how do they get the ball going here?
Yeah, so a couple ways, right? They can email us. Our email address is harmonyhealth@mdanderson.org. They can call us. It's 713-794-9200. Making sure maybe it's 792-9400. Or just look us up at on the MD Anderson website or the Fountain of Praise, right?
We made it very easy at the Fountain of Praise, which is Southwest Houston. We do registration in the church lobby.
Okay.
So after each service, people are able to come and just register.
And we're looking for as many people as possible, whomever wants to participate.
We're looking for 300 Black African-American adults living in the Houston area.
Yes.
Okay. Well, we're going to make it extra easy for our viewers. We're going to put all this information on our website, clicktohouston.com, and from there they can springboard off to the resources that you're offering.
Wonderful.
Yeah, thank you.
Dr. Mama and George, thank you so much for coming in.
Thank you
we
for
do
having
appreciate
us.
your time.
Thank
It is
you.
8:37. We'll be right back.